In Chapter 9, we're going to be talking about health and disability insurance. We're going to look at the benefits and limitations of the different types of health insurance, what type that would be best for you to select when you are purchasing your own insurance. And then we'll talk about some ways that health insurance costs are increasing and what's being done to curtail them. We'll begin by watching this short video from Kaiser, and it basically just gives you a great overview of your health and disability insurance.
Millions of us now have health insurance under the Affordable Care Act, or what some people call Obamacare. But like many things in life, your health insurance can often be confusing and complicated. Whether you've been insured for years or you're new to the game, understanding your policy is important to your health and your wallet. First things first, you have to pay your premium every month or your insurance could get canceled, kind of like your cable subscription. You can also think of it like a shared healthcare piggy bank. We all chip in each month, even if we're healthy, so the money is there when we need it. If you get insurance at work, your employer probably pays most of your premium, and the rest comes out of your paycheck automatically. If you have Medicaid, you most likely don't have to pay any premium at all. The federal government and your state take care of that. If you're insured through a new health insurance marketplace, depending on your income, you may be eligible for a tax credit that pays a portion of your premium. Once you have that shiny new insurance card, you'll want to try really hard to keep it in your wallet. To better your odds at staying healthy, be sure to take advantage of the free preventive services that all new insurance plans provide. But of course, stuff happens. And that's when insurance really comes in handy. Now, having insurance helps a lot, but it doesn't mean all your health care is going to be free. There are lots of details about your insurance plan that affect how much you pay when you get sick or injured. If you have Medicaid, a lot of these services could very well be free. Otherwise, you'll likely have to pay something when you go to the doctor or fill a prescription. This is called a copay when it's a specific dollar amount, like $25 per visit, or coinsurance if it's a percentage of the bill. There's also the deductible. That's how much comes out of your own pocket before your insurance starts paying. Depending on your plan, you might have a deductible for all your care, or it might only apply to some types of care, like hospital stays and prescriptions. So read your plan material, because it could add up to thousands of dollars. Another important part of your plan is the out-of-pocket maximum. This is the most you'll ever have to pay in any 1 year, at least for the benefits your plan covers. Your insurer will pay 100% of anything beyond the maximum for the rest of the year. It can be just as confusing dealing with prescriptions. Your plan has a list of drugs it will pay for, called a formulary, but the prices vary. Check with your doctor or pharmacist because a generic drug might fix you up the same as a brand name drug, but the price difference could be huge. So, those are the costs typically involved. But remember that they'll be affected by your insurance plan's provider network. This is a list of doctors and hospitals that are connected to your plan. Insurance companies negotiate discounts with these providers. Stay in network and the discounts get passed to you. Go out of network, and you could end up paying full price. And remember that out-of-pocket limit? It won't work if you go out of network. In some plans, like HMOs or EPOs, your insurance would pay nothing if you go out of network. In other plans, like PPOs, your insurance will cover you no matter where you go, but you'll pay a lot more if you go out of network. Also, if you want to visit a specialist, like an orthopedist, some plans require a referral from your primary care doctor. Sound easy enough? Well, sometimes staying in network can be tricky. In a hospital, it's possible that your surgeon could be in network while your anesthesiologist is not. If this happens to you, Don't be afraid to negotiate with your provider or file an appeal with your insurer. So, as you can see, there's a lot to think about when you choose an insurance plan each year. Some plans may have low premiums, but fewer doctors or hospitals and high deductibles. There are trade-offs, and understanding and choosing among plans isn't always easy. Remember, if you have questions, call your health plan and ask, or check with your hospital or doctor. If you still have questions, your state insurance department or consumer assistance program can help. With the Affordable Care Act, there's new support for consumers, so take advantage of it. Having health insurance protection is a good thing, especially when you know how it works. We hope you're now better prepared for the next time you have to pull that insurance card out of your wallet. Stay safe, America.
So now let's begin by defining what health insurance is. Health insurance is a form of protection whose primary purpose is to alleviate financial burdens suffered by individuals because of injury or illness. If you have ever known anyone that does not have health insurance and they have a serious illness, it can cause tremendous financial burdens on them. And so we're going to be talking about medical insurance and disability insurance in this chapter. First of all, let's talk about group plans. Typically, your group plans are employer sponsored, and your employers generally will pay some or most of the cost. Previously, most of the time, the employers paid most of the cost, but when the economic downfall occurred back in the early 2000s, most companies cut out a lot of this, and they only began to pick up part of it, and it never did recover. So you will have to pay some of it. The protection that the group insurance provides will vary from plan to plan, so you'll need to know what plan you're getting. The Health Insurance Portability and Accountability Act of 1996, and it's referred to as HIPAA, is federal portability standards, which means everybody has to um, go with these standards. And if you change jobs, you do not need to lose your health insurance. That means you can carry it over from another job to job. Some other things is group policy supplements, and what that is coordination of benefits, and it's the benefits received from all sources are limited to 100% of your allowable, and the clue to this is allowable, and we'll talk more about that later. Medical expenses, and then of course you have individual health insurance, and that is where it can cover either you or your family. And again, the premiums will vary from company to company. Then we have COBRA, and it was established in 1986. It stands for the Consolidated Omnibus Budget Reconciliation Act of 1986. And again, it allows you to keep your coverage from a former employer for a set period of time if you have been laid off. Very, very expensive generally, but it's better than the alternative of having no insurance. So the three types of health insurance we're going to talk about are your basic, your major medical, or a combination of both. Under basic health insurance, you will have your hospital bill covered, room and board, and then other charges such as Band-Aids, which of course you'd be surprised at what the hospital will charge you. Also, you'll have surgical expenses that will include surgeon fees, anesthesiologist fees, anybody that is in within a surgery team. And then you also have physician expenses. They pay for a physician's care, but that doesn't include surgery, for the such as the office visit, lab test, and x-rays. So when you go to a doctor's office, it'll pay for that, and then if you go to a surgery, then it'll cover everything under that. The next one, of course, is your major medical expenses, and this covers expenses for serious injury or long-term injuries or illness. It can include a deductible, co-insurance, and a stop-loss provision. Um, what this would be is if you had maybe cancer, and you were having to go, of course, to see the doctor once a week, then you were having to go to chemotherapy every week, or if you were having surgery or something, under the major medical insurance, it will generally have a cap as to your out-of-pocket expenses, and then it will pick up 100% after that. Comprehensive major medical generally has low deductible, and it's offered without a separate basic plan, meaning I can just get the major medical insurance and it would cover hospital, surgical, and other bills. Be real careful with this one, because you know, might just need to go to the doctor to get a flu shot, and it would not cover it because it's not under major medical insurance. Some other types of insurance coverage that you might be interested in is a hospital indemnity, and it will give you a certain amount for every day that you are hospital. It does not cover medical cost, and it is a supplement to other plans. Um, it would be if I was in the hospital and I had this policy, I could get $75 a day. But it is a very costly insurance policy, so be sure you look at that. And then, of course, you can also get dental insurance, which covers exams, cleanings, x-rays, anything like that. But again, look at the coverage to make sure you know what it covers before you sign that policy. Another one, of course, is vision care, and you can get that. Dreaded disease policy, and it pays out for a specific condition. This says it's illegal in many states. I know it is not illegal in the state of Georgia. My husband has both of these through Aflac. So that's how I know it's not illegal in Georgia. He has the Aflac regular, and then he has the cancer coverage. And then another one is long-term care insurance. Um, this says it makes sense for those with a net worth of $1 million to or 100,000 to 2 million. Covers daily help if seriously ill or disabled, and it'll take care of a nursing home or in care home. I can give you a personal recommendation on this. Don't do it. My husband's mother had this, and she had paid for it for years and years and years. And then she got where she couldn't take care of herself, and we put her in an assisted living, thinking that her long-term care would help pay for it, and it would not, because she was not at home. But yet they would only come in and help 3 hours a day. So my husband's family lost quite a bit of money because of not being able to use this insurance policy. So, and Clark Howard will tell you that long-term care insurance is not what most people think it will be. One thing you want to always know is that all insurance policies will have certain provisions in common, and generally they are your eligibility, and it varies with age, marital status, and dependency. Also, whether or not you assign the benefits to be paid to the doctor or the hospital directly. And then they have internal limits where they have a fixed amount per day for a hospital room. So if you go to a hospital that charges you $900 a day for a hospital room, and your policy only pays $600, you've got to come up with that $300 difference. So make sure you know what your limits are. Another thing that you would always want to look at is your copay, and that's cost sharing in the form of a dollar amount. So if you go to the doctor and your copay is $15 per visit or 10, then that comes out of your pocket. One thing you have to look at is I know a lot of policies. My policy, for instance, is $10 if I see just my regular doctor. But if I go to what they deem a specialist, such as a dermatologist, then my copay is doubled. It goes from $10 or 15 to 30. So know if you're going to be paying more for specialists. Service benefits are entitlements to specific services, and then you do have limitations, and you have a maximum dollar amount or amount of maximum days in the hospital. Most policies, I think, have $1 million cap on your benefits, and then a number of days that you can stay in the hospital unless you're in intensive care or something to that realm. You also want to look at if your policy has exclusions and limitations, pre-existing conditions. A lot of this has been because of the Affordable Health Care Act has been eliminated, so that if I go from one job to another, I cannot be denied insurance because of a pre-existing condition. Most insurance companies will not pay for cosmetic surgery unless it is something that affects your health. For instance, if you need to have rhinoplasty, which is having your nose fixed, if it is affecting your breathing or sleeping, they will pay for that. But simply because you say, I have a big nose and I want to get it fixed, they will not pay for it. Most insurance policies are guaranteed renewable. And then you also need to look at the cancellation and terminations, which explains under what circumstances that the policy could be canceled. Some trade-offs you'll want to look at in choosing your plan is reimbursement versus indemnity. Reimbursement is going to pay the actual cost for your visit. Your indemnity will only pay a specific amount. Internal limit versus aggregate limits is a policy with aggregate limits will limit the total amount of the coverage, which is a maximum dollar amount, and a limit will only cover a fixed amount. And then you want to look at your deductibles and co-insurance. High deductibles or high co-insurance. Does it have an out-of-pocket limit? And the benefits are generally based on reasonable and customary charges. The insurance company will actually do surveys, and in the area, they will look at what a group of doctors would charge for an office visit, and if your doctor is charging 3 times that amount, they will only pay the reasonable and customary charges. And so this is just an overview of some must-haves that when you're considering the insurance policies that you want to look at. Couple things that I recommend that you look at your policy. First of all is the lifetime maximum. Make sure that it is for each family member and not for your entire family. Also make sure that your out-of-pocket expenses are a reasonable amount. The next slide is just a short video, and it's going to be talking about the types of insurance that you can opt out through your employer. So we'll look at that, and then we'll continue and talk about the different types of plans.
Benefit Compare is a web application tool that was created to simplify the complex process of choosing the right health insurance plan for you. In this video, we're going to help you better understand your health insurance and, more importantly, figure out which type is best for you. First, let's take a look at the three types of plans to choose from. With an HMO, or Health Maintenance Organization, you first must choose a primary care physician in your area. Now, the primary care physician is sometimes referred to as a gatekeeper. They're going to be your first stop for care. Now, you can always change your primary care physician. If you need a specialist, your primary care physician will make a referral, and it could take some time to get the approval. With an HMO, you're required to use the limited number of doctors, their connected hospital, and other providers that are members of the HMO network. And an HMO plan does not cover out-of-network care. So the HMO is a more managed type of healthcare plan. A PPO, or Preferred Provider Organization, is a plan where no primary care physician is required. This makes it easier to access specialists. A PPO network is larger than an HMO network, allowing access to statewide, sometimes national provider networks. A PPO allows you to go out of the established networks to receive benefits, although it will cover less of that cost of care. So the PPO is a less managed healthcare plan. EPO stands for Exclusive Provider Organization. No primary care physician is required, making it easier to access specialists. An EPO also allows access to statewide, sometimes national provider networks, but an EPO plan does not cover out-of-network care. So an EPO plan gives you more control of available health care and doesn't require that you have a primary care physician. Now, we should also mention that with each of these three plans, copays, coinsurance, the deductible, and out-of-pocket maximums can vary. And when it comes to true emergency care services, all of these plans will provide payment to any emergency provider. Now you have a better understanding of the three policy types. An HMO is a more restricted and managed care. It may be more difficult to get authorizations for tests and procedures. A PPO is a less managed care, and it may be ideal for those needing more provider options and those who want more control of available health care. And an EPO is a broader, less managed care. It may be ideal for those wanting lower premiums and no primary care physician. This is just one of a few different parts of health insurance you need to think about when choosing the right plan. You can click here for a free printable version of the information in this video. Or click on the following links to learn more about HRA, HSA, and FSA plans, bronze, silver, gold, and platinum health plans. If you want to make sure you can see your doctor, learn about restricted access to your health providers, and health plan terms and definitions.
So what type of coverages should you choose? In an ideal world, you would want to get a basic plan and a major medical supplementary plan, or you could get a comprehensive major medical policy that's going to combine both of these. There's a couple of ways that you can go. First of all, you can have the private insurance company, which is an individual policy, and that most private insurance sell health insurance policies to employers, which in turn offer the benefits to you. Or you can get a hospital and medical service plan. Blue Cross is the hospital part of it, and Blue Shield is the surgical and medical plan. You can also get, under the private health care plans, you can get an HMO, which is short for Health Maintenance Organization. It is a managed care, and it's a plan that directly employs or contracts with selected physician surgeons, every type of primary care physician that you can have, for a fixed prepaid monthly premium. And their focus is on prevention and wellness, and they have a basic supplemental. Under an HMO plan, you have to go to you choose a primary care physician, and that is the only physician that you can see just for your primary care. If you have to go to a specialist, then of course it's somebody that's within this HMO network, but you have to have a referral from your primary care. So it's, you have to look at if you would be happy with what doctors are within that healthcare organization. Another option that you would have to choose is a PPO, which is a preferred provider organization. And it is a group of doctors and hospitals that agree to provide specified medical services to the members at a prearranged fee. You have a several providers to choose from. It does cost more in your premiums, in your monthly premiums, than an HMO, but it allows you more choices and fewer restrictions than an HMO. If for some reason you have to go to a non-PPO provider, you will have to pay more. In the state of Georgia, PPOs are very big because Blue Cross Blue Shield is a big insurance company within the state of Georgia, and most big, large companies do choose Blue Cross Blue Shield, which would provide them quite a few patients. 9 out of 10 doctors in the state of Georgia are what is considered a PPO provider. The next one, of course, is a POS, and that's a point of service, and it combines the features of an HMO or a PPOs. Again, it's just a network of doctors and medical professionals who have contracted to provide the service within your area. So those are the two on this slide. This next one is home health care agencies, and it's medical care in a home setting for a fraction of the cost of hospitals. A good example of that is when you have surgery, like my husband had knee replacement in December. And we had home health care come to the house for 2 weeks to do physical therapy. The cost was about half as much as it cost when he started physical therapy at a regular physical therapy agency. So a lot of companies, when they send you home from the hospital, insurance companies will provide home health care for you. And the other one is an employer self-funded health plan. What this does, it's the company runs a self-insured insurance program, and it collects the premium from employers, but it does pay medical benefits. My husband is employed through Cobb County. They are self-funded, but then they subcontract through Blue Cross Blue Shield. So that's how that works with that agency, but it's a lot of people for that. So it has to have a lot of employees to be able to work. Let's talk about the the new healthcare accounts. In 2003, Congress authorized these to be available to employees, and they're kind of difficult to understand. So I would suggest that if you look at page 297 and 298 in your book, it'll give you more in-depth explanations about these. You have the health spending account, which is that money contributed to this is tax-free. The health reimbursement account, it's tied to your high deductible policies. It's funded solely by employers. What sets this one apart is that unused funds can be carried over from year to year. Flexible spending account, which is one that is available in most companies, and I have used this one, is that you choose pre-tax dollars, and it's set aside so that anything that For instance, you can put in $20 a week, and that amount is put into a tax spending account. So at the end of the year, you would turn in your receipts for co-payments or anything that wasn't covered by insurance, and you would get that money back. The thing with the FSA account is that if you do not use it, it is forfeited at the end of the year. So you have to kind of gauge how much you want to put into this pre-taxed account, because if you don't use it and you have to document, you can't just say, well, I need $500 for a root canal. You have to have receipts, then you lose that money. This is just a comparison that you can look at, and explains it a little bit in more detail. So there are two sources of government health insurance, and that's Medicare and Medicaid. Now, Medicare is a federally funded health insurance program. It covers anyone that's 65 plus, and then some certain disabled people. It does not cover everything, and the patient's liable for any differences in what Medicare doesn't pay and what is called your approved amount. There are four parts to Medicare. You have Part A, Part B, Part C, and Part D. Part A is the hospital insurance. It will help pay for the patient in patient care hospital or skilled nursing facility, following a hospital stay, some health care, and some hospice. Part B helps pay for your doctor's services and some other medical services and supplies not covered by insurance. Part C is Medicare Advantage plans that are available. And Part A, if you have Part A and B, you can choose to receive all of your health care services through one of these providers under the Medicare Advantage. And then Part D is the prescription drug that helps pay for medications. Medicare Choice was created by the Balanced Budget Act in 1997. And what this allows is, if you are eligible for Medicare, you have a choice of the managed care plan in addition to your Medicare coverage. Medigap is a supplementary insurance policy, and it's intended as a supplement to help cover the gaps between what is approved and what you have to pay. And if you say, well, do I need that? If you are a Medicare beneficiary in a HMO, then you may not need it. But a low income generally sometimes do not need it. If they have Medicaid, they don't need it. But if you don't have, I'll give you an example. Is my mother-in-law does not have a medical supplement, Medicare supplementary, so she has to pay all the co-payments, anything that's not paid by Medicare that's a covered expense, she has to pay it out of pocket. So you have to weigh whether or not the difference in paying the premium would be worth not having to pay those out-of-pocket expenses. This is just a comparison of Medicare plans that you can look at. And then the second federal insurance offered for policies are Medicaid. Medicaid is assistance offered to certain low-income individuals and families. Generally, you have to go through the Department of Family and Children's Services and see that you qualify that. It's administered by the state. Some of your benefits are physician service, inpatient, outpatient, hospital, labs, nursing, home health, drugs, eyeglasses, and then preventive care for those under 21. The thing you have to be careful about Medicaid is not all physicians will accept Medicaid. So if you are receiving Medicaid, you need to make sure your doctor will accept it before you go in and see them. This slide just gives you some websites that you can look at for more information on the PPOs, HMOs, and POS insurance policies. The next slide has a short, another YouTube video on what we're going to be discussing about the Affordable Care Act, or better known as Obamacare. Just a short video that just gives you a little bit of information about what it will cover before we go into discussing the components of it.
Well, it's finally happening. After years of drama on Capitol Hill, a Supreme Court case, a presidential election, and a Mayan apocalypse that could have stopped it dead in its tracks but didn't, the marquee elements of the Affordable Care Act, sometimes called Obamacare, are about to kick in. And big changes are coming to health insurance in 2014. In the next few minutes, you'll get a pretty good lay of the land by once again watching your fellow Americans, the U-Tunes, find their way through the system. There are 4 main ways nearly all of us will experience health care once the health reform law goes fully into effect. About half of us will get insurance through our jobs, just like today. About a third will get covered by the government through Medicare and Medicaid. About 1 in 10 will buy insurance themselves. And unfortunately, another 30 million of us or so, just under 1 in 10, still may not have coverage at all. But let's begin in the workplace. Many Americans are already covered by their employers, and for them, not a whole lot will change. There will be some new advantages, though, like caps on how much you have to pay out of pocket, and free preventative care. The bigger changes are coming for those who work for larger companies but aren't covered now. That's because the government is going to require companies with 50 or more employees to cover full-time workers or pay a penalty. So, more workers may find themselves covered. Smaller employers won't face the same penalties for refusing to buy insurance, but they'll be encouraged to do so. The government will be setting up special marketplaces to make it easier for small employers to take the plunge. Some will be offered temporary tax breaks if they do, and unlike now, insurers can't inflate prices if some employees are sick. So, many of us will be getting covered at work. A lot of us will be covered with help from the government, just like today. Not much will change for seniors on Medicare. The law has already started helping with prescription drugs and better preventative care, and that will continue. Medicaid, on the other hand, is expanding to cover more of us, especially poor adults, many of whom aren't eligible today. If your income is low, Medicaid will cover you, most likely in a private insurance plan. But there's a catch. The Supreme Court ruled that governors and legislatures of each state should decide whether or not to be part of expanding Medicaid. In states that get on board, the feds will cover almost all the cost. But for those who don't, you may be left with the same options you have today if you're poor. So you'll want to check out your state's decision if you think you might qualify for Medicaid. Even with employer coverage and the expansion of Medicaid, a lot of us will still be left out. For those not covered or who find their work coverage too expensive, a new way to buy insurance on our own will be popping up everywhere. They're called health insurance marketplaces, though they may have a fancier name than that in your state. The health insurance marketplace is like a virtual insurance mega mall. Here you'll find private insurers competing for your business, and you'll be able to pick out how much coverage you want and how much you want to pay for it. From cheaper, high-deductible bronze plans to more expensive platinum plans. Still, all plans will cover a comprehensive set of services like hospital and doctor visits, maternity care, mental health care, and drugs. Most everything any of us need, at least when it comes to medical care. As with Medicaid, not all governors are on board to set up these marketplaces, but the feds will open their own in those states, and so you probably won't notice much of a difference. One big advantage of buying insurance through these new marketplaces is that the federal government will provide most people with a tax credit to make insurance more affordable if you don't have any other options and your income is below a certain level. In fact, most people buying on their own will be eligible for a tax credit and won't have to pay the whole premium themselves. And the marketplaces will make sure that insurance companies operate fairly under strict rules. They'll have to offer everyone insurance even if they're sick, and they won't be able to charge more for pre-existing conditions. Unlike today, men and women will pay the same price. And prices for older people will come down, while young people will pay more. To keep costs down for young people, though, they'll be able to stay on their parents' plans until 26 and buy low-budget catastrophic plans until they're 30. Of course, all these changes still don't mean insurance will come cheap. Most people buying their own coverage will end up paying less with the new health insurance tax credits. But some people will have to pay more, even though many of them will be getting better and more secure insurance. So let's be realistic. Not everyone's going to run out and buy insurance. Some might say, hold on a minute. If I can't be turned down or charged more, why not just wait until I get sick or injured to buy insurance at all? Well, first, you can only get coverage during special enrollment periods, so if you snooze, you may lose. And second, thanks to something called the individual mandate, if you're not insured, you pay a fine, making this option seem not nearly so clever. Still, if you really can't afford to buy in and can't get insurance anywhere else, the government will waive the penalty, so don't panic. By now, you've probably noticed a lot more people will be getting a lot more coverage. Where will the money to pay for that come from? Taxes. Many of them targeted at the health industry itself, even tanning services. Yes, individuals will pay too, mostly the wealthiest Americans, who will be paying more into Medicare. Also, hospitals and insurance companies participating in Medicare will get paid somewhat less. Not painless, but somebody's got to pay. So, as Americans prepare for 2014, how will you be covered? How would you like to be? Now's the time to figure it out and get on the path to setting yourself up for the best insurance at the best price. After all, who wouldn't want that?
The next couple slides, we're going to talk a little bit about the Affordable Care Act that was enacted in 2010, but was not really put into place until the beginning of 2014. It's known as Obamacare. My suggestion is that beginning on page 302 and going through 304, it goes into quite a depth of detail about this. So I recommend that you read that because I am not 100% about all the exemptions and things like that. So take time to be sure you read that. Some of the key plan provisions is that it does give tax credits to small businesses to offer coverage for their employees. It also prohibits denying coverage to children with pre-existing conditions. It's also a temporary high-risk pool for uninsurable people, and it does eliminate copayments for preventive care. One of the benefits of the Obamacare Act, and a lot of my friends have taken advantage of this, is that it allows your parents to keep you on their current insurance policy until you reach the age of after your 26th birthday. So that's a benefit, that you can stay on your parents' insurance policy. And it also prohibits lifetime caps on coverage that we talked about a little while ago. But the thing that most people do not like is that it does require you to purchase some type of insurance, or you will pay a penalty on your taxes. Now, the ACA, the Affordable Care Act, and individual shared responsibility, that is what is your responsibility. First of all, you have to have minimum essential coverage, or you have to have an exemption that has been approved, or you make a shared responsibility payment with your taxes that I had just mentioned on the previous slide. Some of the essential coverage options is that you have health insurance coverage provided by your employer. You have purchased it through a marketplace. You log on to their website and it gives you some options that you can choose through a marketplace, which is, it's like a big basket and everybody comes in and takes a little bit out of the basket. Coverage provided under government-sponsored programs such as Medicare or Medicaid, and then you can prove you have health insurance purchased directly from an independent insurance company or any other health insurance recognized by the Department of Health and Human Services. How you can be exempt is if you have no affordable coverage option because the minimum annual premium exceeds 8% of your income. So what they're saying is what you pay monthly cannot exceed 8% of your income. Have a gap in coverage for less than 3 consecutive months, or you qualify for the exemptions for a couple of the hardship, or you belong to an explicitly exempt group. And again, those will be covered over on page 304. Make sure you do look at that. All right, let's talk about disability income insurance. You can get short-term insurance or you can get long-term insurance. And it was originally set up to protect against loss of your income. But now it's common today, most insurance company will offer it. And what it does is it provides a regular cash income when you're unable to work. Now, this is not just major catastrophe. This would be if during a pregnancy, a non-related work accident or illness. And it protects your earning power, which remember is your most valuable resource. It varies from insurer to insurer. Some will pay you total 100% of your paycheck. Some are 80%. Some are even 50%. So you would just need to know which type you would want to get. Here are some sources of disability income. Workers' compensation, that is required by employers, and it would cover your income if you're disabled, if you're hurt on the job for an job accident or illness. Some of the employer plans, they include, again, I mentioned your short-term or your long-term group disability. Social Security, you can get that for a total disability lasting more than 12 months, but it doesn't become active until the 6th month that you're out of work. Or you can also get the private income insurance program, which would supplement other income, and it generally will cover 40 to 60% of your income. So just as with other insurance, disability insurance comes with some trade-offs. You need to make sure you know what the policy that you're looking at, what is their definition of disability, to make sure you get that right policy. Keep in mind also that there's always a waiting or an elimination period. It does not begin the day you become disabled. Depending on your policy, you may have to wait anywhere between 1 and 6 months before you can actually begin collecting. And it is called an elimination period. One thing that you want to look at is that a policy with a longer elimination period will charge a lower premium. Duration of benefits. Every policy will name a specific period during which the benefits will be paid. Some are valid for 7 days. Some are automatically canceled when you turn 65. Others would pay you for life. So you want to look at your duration of benefits. You also want to look at the amount. You should aim for a benefit amount that when added to the other sources of your income, it will be greater than at least 70% of your take-home pay. so that you will not suffer financially. Also, you want to look at the accident and sickness coverage. Some policies pay only for accidents. Sicknesses, you kind of have to decide, do I need a policy to cover sickness? That is, for instance, one of my husband's Aflac policies. It covers any type of sickness. So, we pay for that quarterly. And then another thing you want to look at is the guaranteed renewability. If your health becomes poor, your disability insurer may try to cancel your coverage. Make sure you look for a plan that will cover you as long as you continue to pay your premiums. This is a very, very important thing that you want to look at, the guaranteed renewability. This is just a check sheet that you can look when you're comparing disability insurance. I would suggest when you go to work, you print this off and you look at and you compare policies that your company may offer. The last 4 slides are just talking about why we have such high medical costs and what we can do as individuals to help bring those down. This just shows how much the health care was in 2014, how much percentage wise. Notice that 20%, 26% of administration cost is for admin, which seems very high. This slide just shows you some of the reasons for high health care. One of the big ones is the aging baby boomers. And if you'll notice that a lot of the jobs that are available are in the medical field because our population is getting older, and the older you get, the more medical treatment you will need. Here's some of the things you could do about high cost health care. When you get EOBs, that's called explanation of benefits, review it. Make sure it is correct. A lot of companies have incentives to encourage you for preventive care, prepaid group practices, paying cash. If I'm just going to the doctor, I might could take care of that. But if I have to have a hospital stay, that would be very difficult to come up with enough money to pay cash. But a lot of doctors and hospitals, they actually charge you less if you do pay cash. Here's what you can do to reduce your health care. First of all, you need to be healthy, eating a balanced diet, making sure that your weight is under control. Big one, avoid smoking. My mother just passed away this year, and she had COPD. She was a smoker almost her entire life, and I watched her just struggle to breathe, and how sick she was, and how many times I had to take her to the hospital. She told me once she saw a young man smoking, and she said, I would give anything if I could talk to him and tell him to please stop now, because he would be in the same shape I'm in. So if you're a smoker, please think about stopping. Don't drink excessively. Make sure that you get rest, relaxation. Again, exercise, exercise, exercise. Drive carefully, and then protect yourself from medical ID theft. And that is chapter 9, talking about health insurance. And I'm glad that's over. That's a tough chapter. Thank you.